First, I wanna welcome you, Dr. William Hancock, our CDC epidemiologist in this region. Pohnpei is very fortunate to have him visit Pohnpei State, and I'm glad we have the opportunity to sit with you and ask you some very basic questions that will also help people of Pohnpei understand what this thing is all about, and the vaccination especially. So I think my first question to you would be, now we have two types of vaccines, and the question is Moderna and Johnson & Johnson, and are they safe?
Yeah, thank you, Chief of Staff. Those are excellent questions. And yeah, you know, anytime we look at a vaccine and develop a vaccine, there's two things that we look for. One is it effective? And two, is it safe, right? And those are the two main criteria. And so far, these vaccines are amazingly safe, right? So they did the initial studies on the vaccines, and when they got initial authorization was back in December. Since that time, the number of people that have received these vaccines is in the millions, right? At the time of recording right now, over 170 million people in the United States have received these coronavirus vaccines. And throughout all of that, CDC has been in close contact with doctors. Even individuals who are vaccinated can report any sort of adverse reactions to this national database that includes FSM, RMI, and Palau. And they are constantly looking for any sort of signals or signs that these vaccines may not be safe. Now, you may recall a few months back, there was a hold placed on the Johnson & Johnson, right? And the reason for that was that they had identified a small increase of a very rare illness in those individuals that received Johnson & Johnson. So they put a hold on it, they investigated. They did find there were 3 individuals out of the 8.7 million vaccines that were provided that unfortunately had passed away from a very rare condition that was, at the time, hard to diagnose and not treated appropriately by the physicians. Since that time, they evaluated, they saw that there are certain groups that might be higher risk for this complication, but it's extremely rare still. And so they said, hey, that's okay, it's only 3. The doctors know how to treat it. We're going to move on and resume the J&J vaccination. And actually, currently, out of abundance of caution, even though they resume for everyone 18 and over, in FSM, I believe in Pohnpei State, you're only providing the J&J to those 50 and over. That they found it was extremely safe in that age group. For Moderna, for the hundreds of millions of doses of Moderna given, they have not identified one death that's been related to the vaccine. So again, extremely safe. And the big thing to remember is when you're deciding to get vaccinated, or you're encouraging your parents to get vaccinated, the alternative to the vaccine is COVID-19, right? And we know that COVID-19 is a terrible disease. It causes severe illness and death. And at the time of this recording, there are over 3.7 million people known to have died of COVID-19 in the world. That's way more than anything, any risk of the vaccine. So by getting vaccinated, you are now eliminating that risk of severe COVID-19 and death. And so that's really the decision you have to weigh is, hey, do I get this injection of this extremely effective and safe vaccine to prevent this really severe disease that can cause death? So that's, by the way, 3.7 million, that's more than the entire population of all the Pacific Islands that have died of COVID-19 during this pandemic. So it's a big group. It's a dangerous disease. You want to do what you can to prevent it.
Thank you, Dr. Hancock. I think my second question would be, now with the new variants, new types of different variants of COVID-19, is it safe to say that this vaccination we have right now is effective to prevent those?
Yeah, great question. And this is a question we were worried about because we really became aware of the variants as the vaccines were being rolled out. And would they escape the vaccination coverage? Well, it looks like that while they can cause a little bit higher rates of infections in those that are immunized, it's not high enough. So the United States, where there's a lot of variants with the vaccination coverage, we're seeing numbers go down. And it also appears that the vaccines still maintain their great ability to prevent severe illness and death, even in the variants. So we were worried initially if perhaps these variants were going to escape the vaccines. It looks like now we can say they aren't. And so getting your Moderna and Johnson & Johnson vaccine will help protect you against the current variants. Now, I have to say, we don't know what may, pop up down the road, but we know that for the virus that is circulating now in the world and causing death and destruction, the COVID-19, these vaccines are very effective at stopping it.
Thank you very much, Doc. Long-term protection, how long is this vaccine to protect us?
That's an excellent question. And the answer is we don't know. We don't know yet, right? So really the vaccines, Moderna was the soonest, or for you folks, starting rolling out in January. It started rolling out in the US in late December. And those individuals, it's been about 6 months. And so far, they're seeing that it's holding well. So we won't really be able to know that answer for a while. But of course, we're looking closely. We're definitely monitoring for any sort of evidence that the vaccine is starting to wear off. And you may hear in the news a lot discussions about, is there going to be a booster? And a lot of the companies are looking at developing boosters if we do start to see that drop in immunity or protection. But so far, for the first 6 months, it's been holding strong.
Thank you. This talk about herd immunity. Can you explain that a little bit so people understand it?
Yeah, that's a great question. Yeah, so herd immunity, we know from these vaccines that they are really effective, right? They're highly effective at not only preventing death and severe illness, but also transmission of COVID-19. However, nothing is 100%, right? So there are some people, maybe 1 out of 10 who get the vaccine that if they're really exposed, they might get COVID-19. And because of that amount of chance of getting COVID-19 if you're immunized, you want, even though you're immunized, you still want protection around you. In addition, there are some individuals that cannot get vaccinated for whatever reason, and they too will be susceptible for COVID-19. So the goal is if you are able to surround those individuals in your community with other members that are vaccinated, their chance of getting exposed to the virus is much lower. And in fact, the other is true. If somebody arrives in your community who has the virus in them, and the virus is trying to spread, but every person the virus tries to jump to is vaccinated and protected, it can't move. And so then that virus dies. And it doesn't spark off a big outbreak. And it helps protect those other individuals that, for whatever reason, perhaps maybe the vaccine, they're one of those rare individuals that the vaccine isn't going to protect them 100%, or somebody that cannot get vaccinated, or unfortunately, decided not to get vaccinated, and we're still at risk.
Okay, thank you. I would assume that some of those people that have already repatriated, that I understand there were a couple or so that was actually infected with the disease and then cured from it. Now, is there such a thing as natural immunity on COVID-19?
Yeah, excellent question. So we fortunately with COVID-19, people who are infected, they do recover as long as they make it through the illness, they recover and are no longer infectious. You may have heard of those long haulers. These are people that have long-term symptoms from the infection. So just because you recover and are no longer infectious, you can have some long-standing sort of health consequences. So that's another reason why you would want to get vaccinated and prevent yourself from getting COVID-19. Because even if you recover, there's a chance that your life after that, you may have lung problems, or you could have problems with, some people have problems with their brains afterwards. So you want to get protection through a vaccination. But you're right, those that recover from COVID-19 have what we call natural immunity, and that's the protection that your body has made to fight the virus and clear it. And your body maintains that protection for a while. The unusual thing and sort of unfortunate thing with COVID-19 is that we're finding that actually natural immunity seems to wane a bit faster than the vaccine protection. So because of that, there's that recommendation that if you had COVID-19 and recovered, that's great, you have some protection, but we still feel you should go ahead and get vaccinated so that you have that full protection that lasts longer. How we know this was during those intensive studies of the vaccines, we found that some people who had COVID-19 before and recovered still got infected if they were not vaccinated. The people that had COVID-19 and recovered and then were vaccinated didn't get COVID-19. So that's why we encourage the vaccination, regardless of if you've recovered for COVID-19 and have natural immunity. We still want you to get your vaccination.
Okay. Thank you very much, Doc. There are different types of vaccines now. So if you get first shot Moderna, and then when the time comes for you to get the second shot, they run out, Dr. Jim ran out of Moderna. Can you get another vaccine to replace that?
Well, that's an excellent question. Right now, the recommendations are if you get Moderna, you get first dose of Moderna, you get your second dose of Moderna either 4 to 6 weeks after that, right? That's the ideal recommendations. If you get J&J, it's just one shot, you're done. Of course, that is based on how the vaccines were developed and how they were studied. And so they felt that this provides the best protection. As vaccines are rolled out in real life situations, there may be, but hopefully not, we've got a lot of supplies of vaccines in Pohnpei, but there may be situations where that happens, or somebody inadvertently gets the wrong dose, or that sort of thing. And so far they've found that individuals get one dose of one vaccine and a dose of another vaccine. There's generally, maybe they have a slightly more side effects, but there's not some major problems. And the folks are looking at this sort of mix and match of vaccines as well to see if it maybe even improves your immunity. And we may learn more down the road, but currently the recommendations are, if you get Moderna, stick with Moderna. If you get Johnson & Johnson, stick with Johnson & Johnson. And the studies, when they evaluated those dosaging, showed that they're very effective, and they're really good at protecting against severe COVID-19 and death. So, recommend sticking with the current recommendations. But you're right, there may be some changes in the future as they learn more about these vaccines.
Okay. Well, thank you very much. I think my last question before I ask Dr. Jim, and maybe you can also comment on other things, would be, based on my studies on how long it takes to develop a vaccine, an effective one. Based on history, it takes years. Yeah. For COVID-19, it takes less than a year, I would say. And is it really safe?
Yeah, another great question, and an important one. I think there's several things that made us very lucky that we have these safe and effective vaccines so early. So sometimes I feel like all the hopes and prayers of individuals around the world maybe played a part, because everything really seemed to line up to allow these vaccines to come out quite early. The first was these mRNA vaccines, Pfizer and Moderna. that so far of the vaccines have had the best efficacy and have are extremely safe. They were the first two to come out in the U.S. And it's a new technology, but it's a technology that has been under the development for the past 10 years and has been used to make other types of vaccines. So they've already been working on it. In addition, there was a group that was using this technology to build a vaccine against SARS and MERS-CoV. Those are two coronaviruses, and they were looking to build the spike proteins for those two viruses to create a vaccine. And they had just recently, just before the pandemic, figured out how to make these mRNA vaccines for the spike protein, but not for COVID or the SARS-CoV-2, but for the other ones. And so when SARS-CoV-2 hit, the virus that causes COVID-19, they were able to use that technology that they had just made to develop that vaccine. So that sped us up years, because it's like it had started before. The other thing is, the US government at the time said, hey, this looks like it's going to be a really bad pandemic. It's going to impact our world and our country and our world in general, and we need to make an investment now to try to speed up the vaccine rather than waiting the usual 5 years that it would take. And they came up with this idea, which was really smart. First off, it was expensive. They paid a lot of money to multiple different vaccine companies to tell them, hey, don't worry about risking your money to develop a vaccine. Because you can imagine, if you own a vaccine company, not every vaccine works. So you only start with a small idea, you move slow, you test it out one piece at a time, see if it looks promising, then you build the factory to make a few vaccines, then you test it a little bit larger, then you have to recruit a bunch of people to really test it further, and that's going to cost money. Then you have to build a larger factory, and it's a slow step-by-step process before you eventually have a vaccine that you're going to submit to FDA for approval. And if they give you authorization or approval, then you start building the factory and making it. And so by the time there's enough of that vaccine made to get to the community, that process has taken years. So what the federal government said, the US government said, don't worry about risk. We're going to pay you for a certain amount of vaccines, regardless if they work or not. And what we want you to do is, we like your vaccine idea. They had submitted it. There are certain ones that were chosen. We like your vaccine idea. We're going to give you all the money for X number of vaccine, in the millions. And what we want you to do is not only develop the vaccine, start all the studies, phase 2, phase 3, recruit all these people. Usually they space it out because it's too expensive. Recruit all these people to get in the studies and start building your factories now to mass produce the vaccine. So it took that long string that usually takes 5 years, and they just pushed it together. It got really wide, but they're doing it all at the same time to really get there quickly. And so that was Operation Warp Speed that you may have heard of. And so that really helped speed up the testing, evaluation of the vaccines. The good news is each of those testing periods were not shortened. The number of people that had to be evaluated before they moved on weren't shortened. It was just all done at the same time. And so that's why I think it was partly good luck or blessings, to some foresight and investment by the US government. And then, these companies really did produce some good vaccines that really appear to be changing the tide against this coronavirus in the US and other places. I mentioned Israel a lot as another example of where these mRNA vaccines really succeeded in stopping the pandemic.
Thank you, Doc. I think that those are the questions I have in mind, but I want to just highlight the fact that FSM and the state should thank the US government for the support that they have put together and put forth for providing free vaccines to our people. And I think that's where I want to have Dr. Chim comment on people supposed to appreciate these things. FSM is so lucky because of these free gifts, and I think prayers probably part of it. That U.S. government is so generous to provide us. And Dr. Jim, where are we on the vaccination effort in Pohnpei? Because we've heard from Dr. Hancock this importance of this 70% or herd immunity, and if we all work together to reach that, what are the challenges we have now?
Thank you, Dr. Peng. We're at 41% right now coverage. We are still doing outreach in the Hu and Kichi area. I think the outreaches are pretty much going out to look after the second doses and make sure we track the second doses. And CHC is contributing on Sundays, and they're targeting our churches. So we're still way off, but maybe that's one of the things I want Dr. Teng to share, is that coverage. What are some of the advices you have for the general public with regards to just getting immunized, or maybe something you can share with us that would be easier for us to utilize in the long term.
Yeah, I mean, I think one thing I've noticed and really appreciate is, FSM took quick and decisive action early on to prevent the introduction of COVID-19, right? And so we're lucky that the virus is not here in FSM. However, outside of FSM, it has made major impacts. And I know that a lot of our FSM community has family members who had COVID-19 back in the US, or even some deaths, right? And when we look at the data from COVID-19 in the Micronesian communities in the US, they are among ethnic groups, they are often the highest hit, have the severest illness, and have the highest mortality or death rates. And so it is really impacting our Micronesian community in the US, even when they have the US healthcare system and the fancy hospitals and all the ventilators, but people are still dying there. And I worry that while you guys made the right step, this virus is sneaky, and it's found its way into Fiji, it's found its way into Wallis and Ventura, it's found its way into Taiwan. So it can find a way, and you guys have kept it out, but you can't keep it out forever. And right now, you don't have COVID-19 on island. And I think sometimes because of that, there's not that sense of urgency like, hey, let's get the vaccine, let's get it done, let's protect myself, let's help, by getting vaccinated, I'm protecting my family, let's get to herd immunity and just move on from it and eliminate that risk. But I feel like people have to be aware that it is right outside. It's waiting and trying to get in here. And if it gets in here and people aren't immunized, it could be too late. Because remember, these vaccines, Moderna, it's a great vaccine, but it takes a month, right, between the first and the second dose. And then it takes another 2 weeks before you have that protection. That's 6 weeks of you being in the island unprotected while this virus is circulating. If you wait, if you decide, I'm going to wait till there's COVID before I get it, it's already there. The other thing is, once you're infected with COVID, if you go to the hospital and try to get a vaccine, it's not going to help you. It's too late, right? So you've got to get yourself vaccinated now. The other thing is, bringing up herd immunity, is if you get to herd immunity, it really makes all the things that you hear that are being done elsewhere, you don't need them anymore because the community is protected. You don't have to worry or fight about wearing masks. You don't have to close schools. You don't have to close the movie theaters. All these things, because you have that protection and the virus can't spread. And so if you are able to move from 41 to 70%, you not only you're going to be able to protect Pohnpei not only from introduction and spread, you're going to make it so that the hospitals aren't overwhelmed, you're going to really protect yourselves. But if you wait till it arrives, that protection might be too late in coming So definitely, I want people to think, even though you don't feel there's not COVID here, it's not a threat, it wants to get in here. And so go get immunized. If you haven't, make sure your family's immunized. These vaccines are amazingly effective at slowing it, and they're very safe. And so please do get yourself immunized. This is a historic time. There has not been a pandemic for 100 years. And that last pandemic didn't have a vaccine. This work to get the community immunized is going to go down in history as one of the most important health interventions that you guys have done. So it's going to take everyone. It's not something just public health can do. It's really the community saying, hey, yeah, let's protect our island. Let's roll up our sleeves, show our shoulders, and get vaccinated to protect Pohnpei. And if you guys do that, it's going to be such an amazing success story that will be told about FSM when public health people study the Pacific. Because you avoided the virus, and then you protected yourselves when the vaccine was available.
Thank you, Dr. Dane.
Well, thank you very much, Dr. Dane Hancock. Thank you very much, Dr. Raleigh Jim. And I think that, that's kind of all I have to ask and share. And maybe in closing, any last words, Doc?
Yeah, I just, I know that when you talk about the pandemic, there's so many different things and what people worry about, but just really want to focus in that, these vaccines are really the answer. And we've been hoping and praying that we find something that's going to get our world back to normal and get things, back to where they were, where we can, travel and not live in fear. And these vaccines are it. So do your part, help protect yourself, protect Pohnpei, your families. If you haven't been vaccinated, get vaccinated. If you know others who haven't been vaccinated, bring them in as well when you go to get your shot. It's really important, and it's a historic time.
Thank you very much, Doc. Dr. Jim, any last words from you?
No, I think I'm okay.
You're fine?
Yeah.
Okay. So, from us, I think the most important, thank you, Doc, get vaccinated, because the life you save, it's your own. And secondly, the life you save would be the life of someone you love, like your spouse and your children. So please go get vaccinated. And I want to thank these two gentlemen, and also the staff who are, taking care of this interview this afternoon, for the time and opportunity to share this with the people. And I hope people listen and then take responsibility to get vaccinated. Thank you very much.